Had no signs or history of cardiovascular disease, but little did she know that her heart was failing. As we close out American Heart Month, a young woman hoping to raise awareness shares her story of survival with CBS 2's Jenna DeAngelis.
Life completely changed for Danielle Forbes in November. She went from living an active lifestyle to ending up in the emergency room.
I was just watching TV on a Saturday morning. It was like 9 a.m. I remember the specific time. And I just had like this chest pain. I thought it was like heartburn.
Turns out it was a heart attack at 35 years old. Unlike a standard heart attack, there were no visible blocked arteries. This is known as Minoka, which doctors say is more common among women. She was also in heart failure.
If I didn't get the help that day, I probably wouldn't be here telling you the story.
At the hospital where she had surgery, she learned it was caused by spontaneous coronary artery dissection, also known as SCAD.
It's a tear of one of your coronary arteries.
Dr. Isilma Fergus is a cardiologist at the Mount Sinai Hospital.
20% of patients, actually there's no known cause for this, but there could be other causes such as hormonal issues, autoimmune issues such as lupus or rheumatoid arthritis.
Those were all ruled out with Forbes, who Dr. Fergus says is an atypical patient for a heart attack, who, similar to many other SCAD patients, doesn't have standard risk factors for heart disease.
Typically, African-American women have earlier risk factors that cause more devastating outcomes compared with the general population. So things like being overweight and the presence of early onset high blood pressure.
She encourages them to look out for these risk factors and manage them.
It's so important to bring awareness to this because we have to talk about all the health inequities that exist. And for me, it was important to find a doctor that also looks like me.
She says seeing Dr. Fergus, changing her diet, prioritizing exercise, and doing cardiac rehab made all the difference.
It is back to normal. Yeah.
Okay, this is great.
Forbes wanted to share her story to raise awareness, but also to stress the importance of self-advocacy, especially when it comes to your health. On the Upper East Side, Jenna DeAngelis, CBS 2 News.